Hi, everyone. Welcome to this week's Arthritis at Home. My name is Anita Chan, and I'm the Programs Manager at Arthritis Consumer Experts. I'm excited to be talking with Kelly Lendvoy, ACE's Vice President of Communications and Public Affairs today. Welcome to the program, Kelly.
Thanks, Anita. Nice joining you.
ACE recently published a report on the results of the ACE National Survey on Arthritis Medications Reimbursement for people living with arthritis. Kelly, can you tell us a little bit more about the survey and why ACE conducted the survey?
Well, first of all, just a reminder for all of our viewers that this was the second of 4 national surveys that we're going to be conducting in 2021. The first one was on virtual care, and we published those findings in late spring. And this is now our second on reimbursement coverage, and our third we are working on right now on self-advocacy, and we're hoping to publish that during Arthritis Awareness Month in September. So these have been really valuable exercises for us to find out how our members and subscribers and patients living with arthritis across Canada feel about important subjects we didn't just come up with, but that we know patients have told us are really important to them. So certainly virtual care during the pandemic has become a really hot topic issue. And reimbursement coverage is one that year in and year out is something that affects our patients dramatically. We're going to talk about the ACE report card towards the end of this interview, I hope, but that's certainly one of the tools that we've developed around this important subject area. With the national survey on reimbursement coverage, we wanted to identify if there were specific challenges, what the patient experience, arthritis patient experience is, and if there were specific challenges in getting reimbursement for some very valuable and needed life-changing arthritis medications, not just conventional prescription medicines, but particularly biologics originators and biosimilars and targeted small molecule. What the experience has been in getting coverage for those. Just it means there's a little bit of a background. Most Canadians have some access to insurance coverage for their medications through this patchwork of public and or private drug plans. And approximately just under 40% of Canadians have coverage under publicly funded drug plans or programs. And they're generally, they provide drug plan coverage for those most in need. And that's based on age, income, or medical condition. And approximately 60% of Canadians and their family members have drug coverage linked to an employment or private drug plan through an extended health benefit plan. And finally, some Canadians have no effective drug coverage at all, and they pay the full cost of their medications out of pocket.
Kelly, thank you for the summary for the reimbursement coverage environment in Canada. Can you tell us a little bit about who responded to the survey?
Yeah, we actually, we had an increase in number of respondents for our second one. So we're really encouraged about that. And we thank everybody who takes the time to fill out and participate in these surveys. Their participation is really, really valuable. And we want to thank everybody who responded. And roughly the same demographic for this second survey as the first. The majority of people have been living with arthritis for over 6 years, about 40%, and that would be about 60%. 40% had been living with arthritis for less than 40 years in terms of what forms or types of arthritis they're living with. The respondents, or 50% of the respondents, had rheumatoid arthritis. just under 10% had ankylosing spondylitis, and approximately 15% of osteoarthritis, and the remainder, just under 30%, had other types of inflammatory arthritis. Again, a strong majority of respondents were women. That's not too surprising, since arthritis very much affects women more than men. About 80% of the respondents were women. And we had a nice spread across the country of respondents. We had about 30% from British Columbia. The next two provinces, Quebec and Ontario, they're roughly around 26% from there. And then the rest were from the rest of Canada.
What other key findings did you find from the survey?
Well, in terms of the challenges with accessing arthritis medications, a lot of people talked about how their public or private drug plan had declined to reimburse the cost of their med that their rheumatologist said that they needed. That was roughly almost 15%. So a cause of concern for us and something that we need to address. Another 13% of respondents said they did not know how to talk about reimbursement for their medications, so not really understanding the process. So a real education need there. Roughly 12% found the process to get reimbursement coverage difficult. And finally, about 10% of respondents said that they needed, the forms that they needed to fill out were very confusing and difficult to understand.
And there were a lot of open-ended comments to the survey, I believe, right, Kelly?
Yeah, we provide that opportunity, and we find it extremely insightful. You know, the numbers can give us one type of picture, but when we ask for these personal comments, if they want to volunteer them, they have, I think, a much more of a sort of an individual patient and emotional impact. And yeah, I mean, some of the comments, I have a few here in front of me right now in terms of these challenges. And this is sort of representative of what I was speaking to earlier in terms of the percentages of people who found particular aspects difficult. This one person responded and wrote that the approval process for my medication can be somewhat confusing, as several parties are involved: my rheumatologist, the provincial Medicare program, the provincial seniors pharmacare program, the drug company, and of course the pharmacy. So it can be hard to keep track of who does what in that process. So, you know, that kind of personal statement, so revealing, so illuminating, really paints a picture that these numbers, behind these numbers, that kind of personal perspective. So really, really valuable for us. And we read all of these comments really carefully, and a lot of them inform the work and the tools that we develop coming out of these surveys.
And for our viewers and listeners, we're going to be providing the links to the full report. How do the answers of Black, Indigenous, or people of color, or also known as BIPOC respondents, compare to those of non-BIPOC respondents?
Yeah, well, that's a question and a lens that we are looking very carefully through with all of our survey findings this year. Health inequities is one of our advocacy themes at ACE in 2021. We did a deep dive on the virtual care survey findings. And there's actually a JHI dedicated to that subject that we published in earlier in the year. We also looked at that for this survey, and again, some alarming trends. So in terms of that BIPOC patient population, Black, Indigenous, or persons of color, 3 times they were more likely to report the forms they needed to fill out for reimbursement were confusing and difficult to understand. And 4 times were more likely to report that there were too many forms to fill out. So you can see how that segment, and a very important one and an underserved one in our arthritis patient community, having much more difficulty with the reimbursement coverage process than their white peers.
In terms of costs, did reimbursement coverage adequately pay for medications?
Yeah, so that was an interesting question for us, because it's not just a matter, you can't just look at it that Canadians and arthritis patients in this country are, they either have insurance or they don't. There's sort of this third category, and that is the underinsured, and that is they have coverage, but it doesn't adequately pay for all of their medications. And in our survey, what we found with respondents who had private drug plans, roughly 30% of them felt that their private drug plan did not adequately pay for their arthritis medications. And in the case of public drug plans, 4 in 10, almost 40% who were on public drug plans said that they did not adequately pay for their arthritis medications. And so what that means is, instead of it being covered entirely, these patients are being forced to pay, annual deductibles, premiums, or co-payments in order to obtain their needed medications.
It definitely sounds like there is a lot of room for improvement in both the private and public health setting. What are the impact of poor reimbursement coverage?
Well, it forces people to adjust, to adapt, and ultimately disrupt their treatment regime. So certainly it's not something that their rheumatologist would recommend, or a healthcare provider, but they are at a point where they simply don't have adequate coverage and they don't have the funds. So what we found in the survey findings is that almost 10% taking less of their prescribed medication. So that could mean, skipping a dose, splitting pills, sharing pills. So obviously, that is not a situation where we're going to see good health care or good health outcomes. Not being able to fill their prescriptions, almost 10% said they were not able to fill their new prescriptions. So when it comes to adherence, this is a real big challenge for them. And 5% said they were starting to take a different medication. So these kind of disruptions as a result of challenges that they're facing with reimbursement coverage is something that we're certainly going to be following up with when we have meetings with public and private drug plans across Canada.
Yeah, that's sad to know. And also, I know from speaking to patients that some patients are left kind of in the middle of nowhere because they're transitioning from one job to another, or they could be transitioning out from their parents' plan into their own healthcare plan. Kelly, do you have any final comments or additional resources you would like to share with the audience listening and viewing the show today?
Sure. I think, just to summarize the findings and what we're at ACE, what we're aware of, and certainly what a lot of patients are aware of, is that particularly with advanced therapies and medications to treat inflammatory arthritis, such as biologics, whether originator or biosimilar, and target small molecule medications, they deliver life-changing, sometimes life-saving benefits for our patient population, and keep people working, keep people functioning in their lives, whether at home or at work. But we also know that these advanced therapies cost a lot more than conventional medicines. And that has put a pressure on these public and private drug programs. And we understand that, but we also are, very sensitive that some of the steps that these public and private drug plans are taking to try and manage their costs, whether it's public drug plans, restricting coverage for existing medications or delaying access to new medications. It's just not acceptable for our patients. And on the private side, we're seeing private insurers implementing sort of a wide variety of cost containment programs and tools to help, manage their clients, the plan sponsors, the employers' drug plan costs, including case management, preferred pharmacy networks, and that's off again to our patient community. So we're going to continue to advocate. If people go to our advocacy section of our website, they'll see that there is a section on reimbursement medication coverage. There's also ways for them to get involved. But we need to continue to shine a light on this subject area and continue to have, some tough conversations where reimbursement coverage, accessibility, and affordability for needed arthritis medications is causing hardship and forcing, a significant percentage of our community to make difficult choices in how they obtain and stay on their medications. Certainly one way for people to be better informed and to get involved is by looking at our Arthritis Medications Report Card, something that ACE is known for across the country. We've been doing it for a long time, and it's designed to help Canadians evaluate how their province is doing and where it ranks in terms of providing reimbursement for medications, specifically for inflammatory arthritis. And we track the advanced therapy drug or medications, again, biologics, biosimilars or originators, and target small molecules. And they can see what is and what isn't listed in their provincial drug plan. And we encourage people to look at that report card. If their province isn't measuring up, if they feel it's underperforming, they should go to our website and they will find there more information and some tools to help them communicate their displeasure with that, either by speaking to their elected official or speaking to the media or speaking to ACE directly. We're really proud that we were able to put this survey together, and findings from this survey are certainly going to motivate us and inform the work that we're doing for the remainder of this year and going into 2022.
There are definitely lots of ways for people to get involved, and we encourage viewers and listeners to email us at feedback@jointhealth.org if you have further comments or information you'd like to provide to us. Thank you so much again for joining us, Kelly. And we will be posting the resource links at the end of the video and in the description box below. We encourage you to read the report online and share it and include it in your advocacy efforts. And thank you again, Kelly.
Thank you, Anita, and thanks for watching Arthritis at Home, everyone.
Bye, everyone. See you.